Thanks very much for the introduction. So I'm going to talk about our in vitro study with focused ultrasound hyperthermia. From last talk, maybe we know we need some method to make this hyperthermia non-invasively. So at the beginning of my talk, I will introduce what is HIFU, high intensity focused ultrasound, or how it works. So I would try to explain this in the easiest way. So if you imagine the ultrasound wave like sunlight, and the HIFU transducer is like the magnifying glass. So if you put the magnifying glass under the sunlight, what we will get is a very bright, tiny spot. And what will happen if you put a piece of paper at that spot? So the paper may be burned because of the increased temperature. So it's same for the focused ultrasound. So the transducer focuses this ultrasound wave inside the tumor tissue, and the healthy tissue around and also the skin, muscles, they will not be damaged. We only create a very tiny spot with a high energy. And what is important here is we need to know where is the focus point. So that's why we need the MR image to guide the positioning of the focus point. And also, we need to measure the temperature in a non-invasive way. So MR imaging gives the possibility. So in recent years, HIFU ablation has been approved for essential tremor, prostate cancer, and also the uterine fibroids, and also as the palliative treatment for bone metastasis. So there are some clinical available HIFU device on the market. So as we already know, hyperthermia will sensitize tumor cells by stop DNA damage or induce some immune modulation. And different from the other hyperthermia method, focused ultrasound hyperthermia is not only a matter of thermal effect, but also include the mechanical effect or so-called cavitation effect, which may change the permeability of the cell membrane or increase the chemotherapeutic drug uptake in the cells. So here you can see is our focused ultrasound device for in vitro study. So underneath here is the 1 megahertz single focus transducer. So the reason we choose a frequency of 1 megahertz because this is the most common used in the clinical device. And the tumor cells are seated in the special ultrasound penetrable 96-well plate. The focus point is exactly positioned at the bottom of the plate, so where the cells are growing. Then we use the thermal camera here to monitor the temperature changes during treatment with a feedback loop to the motor. So if we, so the video is not working? So here, here is the video. Then you can see the plate is moving during the treatment. So on the left side, you see is characterized acoustic field by hydrophone. So we can see the size of the focus point is same like 1 well in the 96-well plate. And to get the stable hyperthermia, we try to use different acoustic intensity, and we found that at 213 watts per square centimeter, we can get stable hyperthermia at mean temperature of 45 degrees within 2 minutes. Then we combine this focused ultrasound hyperthermia at 45 degrees C for 30 minutes with radiation therapy at single dose of 10 gray to treat the glioblastoma, prostate cancer, and head and neck cancer cells. Because all the cell lines we are using are monolayer cells, so we see them 1 day before treatment. Then we treat them with focused ultrasound hyperthermia and radiation. The cellular NAD pH level is measured 24, 48, and 72 hours post-treatment. Here, the result you see is 72 hours after treatment. So we can see the focused ultrasound itself will not directly kill the cells, but for prostate cancer cell line in a combination group, here is a significant reduction in cell metabolic activity compared to the single treatment. And to understand the mechanism behind, we also look into the DNA damage. So what we can see is combination treatment significantly increased DNA double-strand breaks in glioblastoma cell line T98 and the prostate cancer cell line PC3. So we are now at the first step, and I know we have a long way to go to clinic, but I would say we hope in the future we can have the MR-guided, robotic-assisted focused ultrasound hyperthermia in combination to radiation therapy with the MR imaging for the precise positioning of the transducer and also the non-invasive thermometry. So if we integrate the radiation source to the MR scanner, we are able to perform this combination treatment under the image guidance. And the beamforming of the transducer allow us to treat the whole tumor with the low power focused ultrasound to support radiation therapy. And also the radiation therapy can be performed immediately or during or after focused ultrasound hyperthermia. And I would thank to all my colleagues, and thanks for your attention.
Thank you. Thank you very much for that clear presentation. The paper is open for discussion.
Thank you for your talk and the cute little machine. It's really elegant. But did you try and check what happens when you heat the cells in a different way, just in a water bath or
yes,
something like that?
I tried. So yeah, I tried to treat the cells with incubator hyperthermia or water bath. So all the way I've tried, and I found that I didn't show the result here, but I would say if I treat the cells with water baths, it's less effective than focused ultrasound hyperthermia.
But the duration of the increased temperature and everything was the same between those two?
No, with water bath hyperthermia, we need around 5 minutes to reach our target temperature, but with ultrasound hyperthermia, we can reach the temperature within 2 minutes. So I think it's also a matter of thermal dose. Yeah. So we will get different results for that. Okay. Yeah.
Another question?
To have it clear, the treatment with HIFU can be, in your opinion, combined with the direct hyperthermic effect in order to combine it with radiotherapy? Okay, so something like combined HIFU plus RT at the same moment, yes. So especially for prostate cancer, very important.
Ideal situation. Yeah.
Yeah, I have a couple of questions to your essays. I think, are these adherent cell lines, I suppose?
Yes, yes, right.
So I was wondering about your watts. You're using over 200 watts per square centimeter.
Yes.
If we use this, we blow everything up. So hyperthermia in our case is most of the time 10 watts in these type of environments. So how come that you have 10-fold more energy to get to these temperatures?
So I checked this before and after with microscope before and after treatment, and I found these cells are still attached to the bottom, so they are not really blow up during the treatment.
And how are you dealing with the far field? Because the ultrasound is getting out, so don't you get standing waves and reflection in this type of setting?
Yes, this is really a problem, but because we need to measure the temperature, so we have to leave the far field open, so we cannot put an absorber on top or so. So yes, this is really a problem. So we may have some reflection, but what we concern is, did we reach the target temperature or not? So this is our main target. Yeah, thank you.
So no other questions, so we go further on.
So thank you.